Hi, everyone, and welcome to this session. Um, I'm Subhashni, the host, and here today we're going to be talking about medical education and the entrance exams around medical in 2026 that you might want to focus on, right? So let's get started. I'm going to, uh, you know, share my screen and we'll get started on this. As mentioned, the idea is that we get a very good idea of the medical education options in India and the entrance exams, colleges, as well as the future healthcare trends, so that we can take the right type of decisions. Now, when you really look at it, India's healthcare is transforming, and the demographics and longevity of the population is increasing, while chronic diseases are actually reducing. I think everyone who comes from that particular age group, as me, would remember that when we were kids, we often got some or the other, typhoid or measles, etc. Those are absolutely rather non-existent nowadays, very rare. Now, I am coming to you from careertest.in, which is a career guidance software and service provider. And what we do at careertest.in is we give you a scientific methodology to support decisions around your career, starting with a scientific assessment, then a 20-page detailed report, and then finally suggestion and mentorship so that you can choose the right courses and the right colleges for yourself. Okay. When we look at it, India is at a crossroad where there is a lot of demographic and economic progression which is happening. If you really look at it from the economic increase or ascent point of view, and I'm sure if you've been following the news, you can see that we are growing at 8.2% in GDP terms. India is solidifying its position as one of the world's leading economies. And the macroeconomic validity translates directly to individual level through the increased GDP per capita, that is per person, which was recorded as approximately $2,481 in 2023. Now, this steady rise in disposable income is leading to an expansion of the middle class and the upper middle class of society, which fuels an unprecedented demand for high quality specialization and preventive private healthcare services. Now, this is also, look at it in context to demographic transition. You can see that the dramatic and rapid decline in its birth rate has happened, and we've actually fallen to 1.9% for the entire country, which means that from 2000 onwards, our population is not increasing because of the birth rate. It's actually increasing because people are staying longer. So what are we saying? That there is a longevity challenge, the engine of population growth, because people life expectancy has increased substantially. In 2021, it was on an average an Indian lived for 67.3 years, which was far improved as compared to what when the Britishers left, which was at some 40s, in the 40s. People used to die that young. There has also been a shift in the decrease in the chronic diseases category. The increase in the chronic diseases category, decrease in the conventional diseases category. So, chronic diseases is diseases which have been caused by sedentary urban lifestyles, and these diseases are non-communicable diseases, so they don't shift from one person to the other, and it includes conditions like diabetes, high blood pressure, cardiovascular diseases, respiratory diseases. So what are we saying really is that age related disorders are going to rise, and that is the implication when you look at it in terms of the in what's going to happen in the healthcare and demand sector. So we have a rising GDP, rising per capita income, growing middle class, which is the increasing the demand for quality healthcare. And demographic, we have understood that the birth rate has dropped to 1.9, which is below the replacement level. If we were all living to exactly the same age as earlier, we would our population would actually be declining. But we know till 2060 India's population is going to increase, which is driven by literacy, education, and family planning. The That means that you're going to have more literate people in the younger generations, but the population increases because of the longevity. The longevity challenge has a few things. There's the problem is, one is that life expectancy is rising, elderly population is increasing, and there is a huge need for geriatric care, that is the care of older people, and chronic disease management. Often these chronic diseases are caused by lifestyle. The So what are we saying? There's been a shift from infectious diseases to chronic diseases. There's more diabetes, hypertension, and cancers, and there is a need for long term specialist care for a large percentage of the population. So what are we looking at? We are really looking at the fact that certain specializations are going to be in demand. What are these specialization? There is going to be geriatrics medicine, which is one of the most in demand super specialization currently. Then NCD focused specialties like cardiology, oncology, endocrinology. Then you're going to have neurosciences and dementia care, which is going to become extremely important. So for stroke and dementia, and super specialization has become essential. So nowadays, general doctors are reducing as a percentage. There more and more people need people to go to super specialists. Then there is a rise in the allied health sciences also. So because there is so much specialization, there is a older population. What are we seeing? That there is a huge requirement for radiology technicians, operation theater technicians, dialysis technicians, cardiac care technicians, and physiotherapists. Okay, all of these have become the backbone of India's healthcare system. So we are saying that B Pharma, biotechnology, clinical psychology, hospital administration are becoming extremely important. Now, at this point, I'll pause and ask you: are you thinking for your for someone in your family or for yourself? Are you looking at doing a medical degree? Then this is going to be really interesting for you, and I do hope that you will reach careertest.in to understand which type of specialization and which type of degree amongst the healthcare and the allied healthcare would work for you. The first thing to understand, therefore, when we look at the medical entrance exams, is the fact that the NEET is the big gateway into the national wide entrance exam for MBBS, BDS, and various Ayush courses which the government runs. And the total marks for this exam is actually 720. You need three subjects in your 11th and 12th, which is that you need physics, chemistry, and biology. And the duration of this exam is generally 3 hours 20 minutes. The marking system is MCQs with negative marking. So if you make a wrong choice, you actually get a negative marking. AIMS and JIPMA, etc., they only consider NEET scores for MBBS admission. So it is the gold standard when you come to exams that you must do. Now, eligibility criteria and college types. So you have some compulsory subjects, as I mentioned, in class 11 and 12. You have to take physics, chemistry, bio, and English in 11th and 12th. Okay, so maths, if you notice, is actually a optional subject here. So without bio, MBBS is not possible. So if you have done PCM for whatever reason and you think you can do your medical, that's not going to happen. Now, generally in PCB, you will look at 50% marks for people in the general category and 40% for OBC, SC, STs. PWDs get 45%. These are the minimum marks you need to get a entrance exam call. So India has more than 706 medical colleges and 1 lakh 8,000 plus MBBS seats. There are at least 1.25 lakh doctors seats which are available every year. Okay. Which are available around government colleges, which have the lowest fees and the highest competition. Then you have the private colleges which require NEET ranking and they have higher fees. And then you have the deemed universities which are the premium private institutions. Now armed forces medical college takes in NEET scores plus interview and medical fitness. Okay, so these are things to be considered when you're looking at uh, planning for the medical exams. When you look at NEET, really, you know that after the exam, you will actually have counseling. So you have the All India quota, which is AIQ 15%, which is conducted by MCC. And then you have the state quota 85%, which is reserved for state domicile students. You will get a chance to get selected into colleges which are in your state. There are often multiple rounds of interviews that you can have: round one, round two, some mop up interviews, and then lastly, some stray vacancies, somebody drops out, etc. When you look at the medical career path, right? So you might think that how long will the medical studies take for me? The medical career path, actually, the MBBS is 5.5 years, and this includes a 1 year internship. So it's 4.5 years plus 1 year. NEET PG or next for PG specializations, you have to go for. Then you have the MD, which is non surgical, and MS, which is surgical, which could take 3 years. And then you have the DM and the that is the super specialization degrees which you can have for furthermore for 3 years. So you can look at a decade or plus of studying when you go to medical. So what exactly do you need to consider for you know getting into healthcare? One is that aging India needs specialists. Then you need chronic disease management to happen, which are all lifestyle related diseases many times. And then you need holistic teams with allied health services. Sciences. So it is not only getting into MBBS, it also means you can look at getting into becoming a technical technician, or opening your technical center for radiology, dialysis, cardiac care, etc. Okay, so there are many options now. At this point, I'm going to take a break and ask you that are you really thinking that is medical for you or not? If yes, then it is very important for you to reach out to us. We are specialists in being able to map out for you which what are your strengths, and therefore which type of courses you should do in college, and then finally top it up with giving you advice for which types of colleges, which types of entrance exams. I hope you session, and I'm open for any questions. I'm open to any questions. So, with this, I'm going to take my leave with this small nugget that in case you're confused or you feel you need, um, uh, you know, um, professional help, okay, reach out to me. You can start off your career guidance journey by yourself, or you can leave a comment and then we can discuss how to take your career guidance journey forward. With this, I'll close streaming and I look forward to seeing you in my next stream. Bye. I do hope you will like and subscribe to the channel too.